Thank you very much. Good afternoon, everybody. Before I start, I would like to take a moment of silence to observe the inhumanity that is taking place in this world, to observe the deaths of so many millions of Americans and people across the globe, and the frontline workers and the advocates who have been fighting day and night for years and decades for people to have basic fundamental human rights. So I'd like to take a moment of silence to recognize their work. Thank you. People and their rights must be a front center of response and recovery. We need universal rights-based framework like health coverage for all or Medicare for all in the United States to beat this pandemic and protect us from the future. This pandemic is taking innocent lives daily all across this country, whereas those lives can be saved if we had a better healthcare system and if we had the willpower among our elected officials. This pandemic has reinforced two fundamental truths about human rights. The COVID-19 pandemic has had a disproportionate impact on vulnerable groups, including frontline workers, women and girls, and minorities, black communities and brown communities in the United States, all across the globe. It has thrived because poverty, inequality, discrimination, the destruction of our natural environment, and other human rights failures have created enormous fragilities in our societies. At the same time, the pandemic is undermining human rights by providing a pretext for heavy-handed security responses and repressive measures that curtail civic space and media freedom and fundamental right for each individual to have a proper and accessible health care. Health care is a fundamental right of each individual, regardless of their background, color, race, gender, religion, no religion, or sexual orientation. It is inhumane and it's pathetic. It's unacceptable in a country like United States of America, the richest nation on earth, cannot provide basic health care to the American citizens. It's a shame on both sides of the aisle, whether you're Republican or you're Democrat or you're independent. It's shameful that you cannot stand up and have the willpower and the political will to take care of this tremendous problem we have in this country. These are staggering statistics that I'm about to speak about. And as a humanity, we should be ashamed. The privileged class should be ashamed. The elected officials, the people that sit in the chambers in their silk ties and their silk scarves should be ashamed of themselves. 9 out of 10 people in 70 low-income countries are unlikely to be vaccinated against COVID-19 next year because the majority of the most promising vaccines coming on stream have been bought up by the West. I repeat, one more time, 9 out of 10 people in 70 low-income countries are unlikely to be vaccinated against COVID-19 because most of these vaccines have been bought up by the West. Supplies of the Pfizer-BioNTech vaccine approved in the UK last week will almost all go to rich countries. 96% of doses have been bought by the West. The Moderna vaccine uses similar technology, which also is claimed to have 95% efficacy and is going exclusively to rich countries. The prices of both vaccines are high, and access for low-income countries will be complicated by the ultra-low temperatures at which they need to be stored. In other words, most of the poor countries do not have access to these vaccines and do not have the facility to keep these vaccines. The current system where pharmaceutical corporations use government funding for research retain exclusive rights and keep the technology secret to boost their profits. Now, in America, the pharmaceutical corporate hijacking of the American healthcare system is crimes against humanity, period. And if you cannot acknowledge that, and if you cannot see that through your conscience, then you really have some problems. In this country, for decades and decades, communities, especially black and brown communities, have been suffering immensely because they do not have access to proper health care. People in rural communities have to drive over an hour to get checked. A lot of poor communities do not have access to good transportation, cannot afford cars because they don't have good jobs to buy the good cars, they don't have good money to pay for car insurance. And you add up all that. You have people dying because they cannot get proper checked. You have people dying that their lives could be saved if they have early detection, if you have preventive measures like in Europe. And Medicare for All does all that, changes all that. But we don't have that. Why? Because we don't have the political will. And the political will is going to come when ordinary Americans, white, brown, and black, especially the privileged class in this country, stand up and speak out and elect people that are standing for the people, not for corporate interest. It's a travesty in this country right now, as wealthy as we are, that we cannot provide health insurance to every American. I don't have health insurance. I don't have dental insurance. I don't have vision insurance. There's so many people across the America that I've met in rural communities. In this area in Raleigh, especially black and brown communities that do not have proper health care, do not have health care, period. They don't even know if they have COVID-19 or not. They don't have the information where to go and get checked. In the meantime, all these executives from pharmaceutical industries make millions of dollars, millions of bonuses, enjoying their lavish lifestyles. Meantime, we're electing elected officials who are complacent, complicit. You reach out to them about these issues, and all we get back is empty promises. These political slogans are not going to save these lives anymore. The will of the people will. A tangible change in policy in healthcare. And Medicare for All is the solution to fix the American healthcare system. Thank you.